Hi everyone, Dr. Michelle made it back for my second live on YouTube, and I'm going to be doing today's testimonial. And today's testimonial is going to be a case study, and I am the patient. So I've been experiencing some chronic issues. Some of you that know me have helped me through some of this, and I've been sharing about it because it's affected my life greatly. However, things have turned the corner, yay, and I'm about to share what some of those things are. So feel free if you have a question or a comment. If you have a question, please put it 3 red question marks, and then I'll be able to see that that's a question. If you want to put a comment in, just put your comment in anytime. So the condition that I have, well, first I'll say the case study is a middle-aged woman, and that is me. And I've had a history of pain in my arms, hands, and fingers for 4 months, to just summarize the particular condition. I would note this to be left lateral epicondylitis. So that would be this particular kind of bony prominence out here, just by the elbow, and which a lot of people have experienced. They either get the medial epicondylitis, the golfers, I'm forgetting the two different terms. There's golfer's elbow and tennis elbow. Um, so I have I had left lateral epicondylitis of my left arm. Um, I'd also say that it went into a muscle spasm into this forearm. And so I had arm strain, tendonitis, it could be termed, and muscle spasms. So I'm sure you probably can all relate to some of that. And then on this arm, I experienced severe neuropathy, which, if you don't know what that is, that's a nerve pain. And that can stem from the nerve roots of our neck area, the cervical area, from if we're misaligned or we have impingement, tight muscles, herniated discs, that can create that nerve pain that one gets down the hands, fingers, and arms. I do have a history of herniated discs, spinal stenosis, and many other things in my neck, probably from being a dancer and balancing things on my head and doing floor work with that. And then also being a massage therapist, that puts a lot of strain on your cervical areas. So I do have a lot of different Western medicine diagnoses, but I've been able to, over the 30 plus years, manage that with acupuncture, massage therapy, herbs, all sorts of wonderful things that have basically taken the pain away and managed that. So that's just kind of a side note. But this experience that I had about 4 months ago, let me explain how it occurred. And it's pretty uncanny, but pretty understandable in today's age with the mobile phone. I'm on my phone a lot, like my mini computer, like people are on their regular computer. And I was laying down a lot and holding my phone in a fixed position and not realizing that my arm was in a crimped position like this, a fixed position. And I was doing that over time, and it became what we call a repetitive overuse syndrome injury. And what happened was it got so angry and irritated. The blood doesn't flow well when you stay in a fixed position. And it created a spasm and a tightness, and it irritated my nerves and my tendons. And that's how I got the tight forearm muscles that were spasming, the lateral epicondylitis, which is the inflammation around the elbow, and it became this big chronic condition. It worsened because I was packing for a trip, so I was lifting a lot of items that I shouldn't have been lifting, and then I had to go travel, and I was also schlepping and carrying a lot of items I shouldn't have been. In the meantime, my history of having the neuropathy that I usually keep at bay with my neck and shoulder herbs and getting regular acupuncture treatments twice a month, that got aggravated as well. I was also using this arm and hand more because this arm was in so bad a shape. So the neuropathy in my fingers, which is tingling, pain, burning. I had mostly numbness and tingling. So that's, you can have burning too, which is nerve pain, and neuropathy. So I had a lot of the neuropathy coming on while I was traveling. I was carrying things in my hand, which I shouldn't have been, which was aggravating. I was putting things up here, which usually I'm the purse police, and I tell my patients, do not put anything on your neck and shoulders, because that will create more more trauma, more trauma to the area. So usually I say nothing on your neck and shoulders. Well, I had to do that because I didn't have a Sherpa traveling with me. Next time, I hope I do. So I want to hire a Sherpa for my next, at least my international travels. But so I was doing all this heavy lifting and traveling and schlepping, and it made my condition even worse because I didn't stabilize my condition before I went off traveling. So it just worsened the condition. And then on top of that, I ended up getting COVID on my trip. So that creates a lot of inflammation and, inflammation all over your body and pain. So I had all that going on and came home early from my trip. I'll have to redo that trip. It was a dream trip that didn't work out, but that's okay. So nonetheless, moving forward, I got back home and I started on my neuropathy herbs, which I'm going to share with you. And I started doing some acupuncture, which if you watch my acupuncture live video, I have that in my playlist, I think under Chinese medicine playlist. And I think I also did arm and elbow. So you can watch those acupuncture just to get a little snippet of acupuncture if you're not familiar with it. And I was just doing that minimally because I didn't have an acupuncturist at the time. I had one, but not somebody that I really, could call on a lot. So I was doing some acupuncture myself, a minimal acupuncture. I was getting massage, which was very helpful. I get regular massage twice a month for about 2.5, 3 hours. So that's very helpful because that helps loosen up all these tight muscles in the arm and in the neck and helps everything to relax. So I was doing that. However, I wasn't getting enough relief. I was also in my infrared heat sauna, which is part of my med spa services I have, which helps joint pain and all sorts of pain and other types of conditions. So I was using the infrared heat sauna, and I was also, which I sleep on every night, on my infrared heat chakra crystal mat, which was very healing, but it just wasn't remedying these specific issues. It was very hard for me to use my right hand. I was just to turn things, work, do massage, do acupuncture. It was really hurting my fingers. It was very hard to function. I also had very much difficulty getting my tops on because I couldn't really raise my arms. So I was very limited in my range of motion. So that's how, it was a severe condition, what I'm sharing with you all. And I don't recall ever having that type of severity and that length of time because this occurred over 4 months. So with all of that, I started incorporating and really bumping up my herbal medicine. And when you're on a lot of herbal medicines, for myself, I can't swallow a lot of capsules. And in order to get enough of the grams that you need for a good dose when you're suffering a severe condition, you have to up the amount of grams in the repairing and stabilizing phase. And so I was doing the herbal formula is called Flex NP, and I do have this on my website at www.designtoheal.biz, which is in my About Me in my YouTube channel. All my links are also there from my website. And so this is the Flex NP. This is the granular, which I normally take the capsule, but I was having to really take a high dose because my symptoms were so severe with the neuropathy, that I started incorporating the powder because I was on multiple herbal formulas for muscle spasm, nerve pain, neck and shoulders, all of that. So this is the capsules, very easy to take, very, nice and small and manageable. There you go. Easy to swallow if you have difficulty swallowing. So I was incorporating capsules and then also the powder, which you would mix in just room temp or, room temp, not cold water. And then you would drink all the herbs. I usually do it like in a little shot glass or just a little cup. And then you want to make sure that you're getting all of those herbs in the cup of water. So I just keep filling up my glass until all the herbal sediment is gone. And you really have to be consistent and compliant daily with your herbs, just like you would your Western medications in order for it to work. And you have to be on the right dosage. So I encourage all my patients, if I'm not seeing them live weekly, then to be in communication with me either via telemedicine or on the phone or via text, how they're doing with their dosing and if we need to adjust the dosing or the herbs that they're taking. So we get great success because a lot of times people will say, well, it didn't work, or they could say that, which in the olden days, I didn't follow up with people, kind of being a rookie. And now I know that you really have to have communication with all your treatments with your patients to really just check in and make sure that they're on the right track and help them along the way with any questions they have. So communication is key in everything in life, right? So a few other things here. So I want to say the stars of the show, besides my fabulous masseur, getting my massages, was the herbal therapy that I was doing. And I was taking my neck and shoulder herbal formula, my Flex NP, my bone herbs, which is great if you have osteoporosis and need bone support. I might have this already on a video, but this is a great one also if you fracture a bone. I've taken this for bone fractures and it helps. I can literally feel my ribs and my toe healing when I fractured them. So this is a great one. I was taking my bone support, which I take every day. And then I was taking my Flex SC for the spasm type muscle, which I still have a little bit of that left due to the chronic condition that it became. So I might take an occasional Flex SC for muscle spasms, but I really don't need to. And then there's also the arm support. I was taking some of this. So as you can see, I was on at least probably 5 herbal formulas during my trauma support and injury treatment. And I just dosed it as I knew how to. And you usually have to take more of the herbs for whatever the primary complaint is. And then we can add in the extras if needed. The other star of the show, besides the Chinese herbal formulas, is the essential oils. And this was a new combination that I started using. I normally am a lover of the Deep Blue blend, and I use that a lot in my treatments with my patients and on myself. It's a great athletic blend to use pre and post athletics for pain and inflammation. However, I was using that, but I wasn't really kind of getting the deep treatment that I needed and wanted from it. So I decided to try something different in the doTERRA company. And doTERRA, I also have my website in the link in my About Me on my YouTube channel, and it's also on my main website. But I decided to start taking, I actually had some of this on hand and I hadn't tried it before. And they've had this quite a while, cobaiba, which is a wonderful anti-inflammatory. It's a resin that comes from the cobaiba tree. And this company harvests it in Brazil. So it's a tree in South America. And it's a resin that is extracted, the essential oil, and it does have CBD-like derivatives. So it also can help anxiety, sleep, calming, and inflammation. I was using it primarily for inflammation and pain. So before I started taking this, I was taking Advil, which I usually never take along on the side of along with my herbs, not at the same time, but I was taking Advil, which I never take unless I'm in a emergency, and I was also taking prescription muscle relaxants, which I never take. I don't take pain pills because they're prescription pain pills because they're like toxic in my body. I get headaches and I can't function on them. But I was taking prescription muscle relaxants at night. I was feeling so groggy and out of it the next day. And then I was taking Advil around the clock as prescribed, which I don't like doing. Once I introduced my internal cobaiba, these are soft gels, so easy to swallow. I love easy to swallow little pills. These are little soft gels. Get into the camera here. Here we go. And I was taking my cobaiba. I was taking these on a regimen of about 3 to 4 times a day. And I started with two at a time because I really wanted to kind of bolus up my dose in the beginning. And I was dosing 3 to 4 times a day. So I was kind of replacing it with the Advil. I was able to get off all Advil and all muscle relaxants within a couple of days. I'm not kidding you. And this had results for myself immediately. And I could feel things healing and I could feel the inflammation going down in my body. So the other thing that I was taking along with that was I was doing the topical cobaiba. And I was putting that right on my elbow and my whole forearm and then rubbing it on my fingers. But you just have to be careful if you are using this on your hands and fingers, not to touch your eyes with your essential oils because they can irritate and burn your eyes. So I was using the topical. This is the cobaiba Touch, which means it is mixed with the fractionated coconut oil. So it is a dilute formula. Very effective, and it blended very nicely. I paired that with our golden herb, or not herb, our golden essential oil. This is like the god of oils, the gold of oils. They say if you don't know what to prescribe, use frankincense. So I added in frank along with my topical formulation. And let's see if you can see that frankincense, which I'm sure you've all heard of. This is also frankincense touch, so it's a little less expensive because it is diluted. I don't know how to hold this well. It is diluted with the fractionated coconut oil as well. And frankincense is great for so many things. We don't have enough time for me to go into it all, but for my condition, I was using it basically for tissue regeneration and pain and inflammation. So it was healing and repairing my tissues and the injuries that occurred. And I paired those two together. Let's see if you can see them together. I paired those two together. I was putting these on probably at least 3 to 4 times a day as well in the beginning, in the severe state. And then as I started getting better, I started I was able to reduce my soft gels to probably twice a day. And then I was also applying my topicals twice a day. And then now I'm at a point where I'm probably I'm about 95% better on the neuropathy. I have just a hint every now and then. I can feel in my fingers, but it got significantly reduced. I have full use of my hand, and my arm is wonderful and happy. I can get dressed, I can work, I can move, and I don't have pain. The only thing I have is just a little bit of residual tightness in this muscle. So what I'll do a lot of times is at night before I go to bed, I'll take my Cobiba soft gel, and then I might apply some of the topical just to keep it happy and healed while I'm sleeping. Because sleeping is a great time, to do your herbs and your medications, because we're sleeping, we're resting, we're healing, and it's a good time to take care of yourself. So that was my regimen. Those were the stars of the show, and those can all be found, like I said, on my website, my main website at designtoheal.biz, and then you can find my essential oil website. If you need help and you need me to order something for you, or you want to do a telemedicine, a deeper dive, we can do that as well. And I can guide you with whatever you are experiencing. So just to summarize, and just to, again, I really just have to say I'm probably 95% healed on both areas, both arms. So that is huge. And I've been singing the praises about the Cobiba, and I'm always singing the praises about the herbs. The herbal company I use is out of LA. They do about 15 different quality testing on their herbs. And I do have some videos in my YouTube playlist about herbs, and those can be shipped directly to you, or I can get them. And if you're close by, I can drop them to you. You can pick them up at the office. The essential oils, you can save 25% if you want to get your own oils, and I can share with you how to do that. And you'll also get a complimentary oil consultation and a deeper dive on your specific health conditions and what to take. So let's see. I think that's about it. So that's today's testimonial, and I am the testimonial, and I'm singing the praises. Again, with any type of therapy, you have to be consistent, you have to be compliant, and you have to have the right dose. And the way that you do that is stay in communication with your practitioner. And I'm always available for my patients via text, email, phone conversation. I don't charge for, a quick call with a couple questions, only if we're doing a telemedicine appointment, and then do I start charging, and that's 15 minutes or greater. So you do also get a complimentary 5-10 minute consult with me if you just want to see if I'm a good fit for you and start your healing and your rehab. And some of my specialties, as I've shared in the intro, is pain conditions of all kinds, mental health conditions of all kinds, anxiety, stress, depression, sadness, sorrow, grief, fear. We can really address a lot of those specifically. And then also weight management, weight loss, whatever your goals are for that. And then, like I said, we can treat every system of the body. So I'm here for you. Please reach out if you have any questions. And I'll look forward to doing more lives for you and being more available for you as well. So until then, everybody take care and take this week on in a positive, powerful way. Okay? All right. Ciao for now. See ya.